Questions about your personal health. I think I am infected with the novel coronavirus. What should I do? For everyone in the Netherlands, stay at home with symptoms such as a head cold, cough, sore throat, or fever. These are mild symptoms. Avoid social contacts. Limit visits to vulnerable people. Only call your GP if the symptoms worsen, a fever above 38 degrees Celsius and difficulty breathing, and you require medical assistance. If you feel better and did not have any symptoms for 24 hours, you are cured. You can no longer infect others. Who are meant by vulnerable people or people with poor health? Vulnerable people or people in poor health are people over 70 years of age and people who have one of these conditions: abnormalities and dysfunctions of the respiratory tract and lungs, chronic heart disease, diabetes mellitus, severe kidney disease leading to dialysis or kidney transplant, reduced resistance to infections by medication for autoimmune diseases, after organ transplant, hematological diseases, blood diseases. In the case of congenital or later immune disorders requiring treatment, in case of chemotherapy and/or radiation in cancer patients, an HIV human immunodeficiency virus infection in consultation with the treating physician. Can I do a self-test with so-called quick tests? RIVM is aware of the fact that coronavirus self-tests are being offered. These tests are not self-tests, but rapid tests, or snel-test in Dutch, that are not intended for home use. They are intended for professional use. Only accredited laboratories, such as those of RIVM, use tests that can determine whether the coronavirus is present in a patient. The rapid tests offered show, by another method, whether someone has recently, a week or more ago, been in contact with the virus. However, these rapid tests cannot determine whether someone is carrying the virus at the time of testing or whether he or she is contagious at that time. Users may become unnecessarily worried, or they may be wrongly reassured. The Health and Youth Care Inspectorate has also published a report about this. Tests that can be used at home to check whether you're infected with the coronavirus are prohibited if they have not first been assessed by a notified body. I am a roommate of someone who is sick. What should I do? Stay at home if you have symptoms like a head cold or a cough, a sore throat or a fever. These are mild symptoms. Avoid social contact. Limit visits to vulnerable people. Only call your doctor if the symptoms get worse, a fever over 38 degrees Celsius and difficulty breathing, and you need medical assistance. What are mild cold symptoms? Mild cold symptoms are a nose cold, runny nose, sneezing, sore throat and slight cough, and a slight temperature up to 38 degrees Celsius. Is the novel coronavirus COVID-19 more severe than the regular flu? At this point, we do not know. The novel coronavirus COVID-19 is a new virus. Therefore, it is vital to obtain very detailed information to determine precisely how dangerous the virus is. More information is needed about the spread of the virus, also about the people who became only slightly ill or not at all ill. What is the advice for people who are vulnerable or have health problems? Avoid contact with other people as much as possible. Avoid large groups and public transport. Everyone is urged to limit visits to people with health problems. Follow the hygiene measures and certainly stay away from people who are ill. How long do you have to stay at home if you have a cold or a fever? People with a fever or a cold should stay at home. You also have to limit your social contacts. One day after symptoms are over, you are no longer contagious. You can continue your work, but from home as much as possible. If you have a fever above 38 degrees Celsius and difficulty of breathing and need medical assistance, call your GP. How do you know if you are cured of the novel coronavirus, COVID-19? If you feel better and have had no health problems for 24 hours, you are cured. You cannot infect others anymore. I am pregnant. Should I be particularly worried? No. We see the virus infection has the same course as in women who are not pregnant. As far as we know, there is no increased risk of miscarriage or birth defects due to infection with the virus. Based on the current available data, the consequences of an infection with COVID-19 in a pregnant woman do not appear to be different for the child and the mother than for other infectious diseases that cause fever. Can I still visit my parents? Anyone older than 70 and people with underlying health conditions are extra vulnerable if they are infected with COVID-19. For this reason, limit contact with these groups and certainly do not visit them if you have symptoms such as fever, a cough, or a cold. Can I still go shopping? If you don't have any symptoms such as a fever, a cough, or a cold, you can go and do some grocery shopping. If you keep at arm's length from others, the chance that others will infect you with COVID-19 or that you will infect others is small. Can I still walk the dog? If you do not have any symptoms such as a fever, a cough, or a cold, you can walk your dog. If you keep an arm's length away from others, there is little chance that others can infect you with COVID-19 or that you can infect others.